Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Joel Nerem. He's a veterinarian at the Pipestone Veterinary Clinic in Minnesota. Great to see you, Joel.
Thanks for having me.
We're going to talk about a complicated subject today. We'll try to make it simple, and that's antimicrobial resistance. You and your colleagues are trying to take this to the field and see what it really means on the farm. What exactly are you doing?
Sure. Well, obviously antimicrobial resistance is a pretty important topic. It's particularly a topic of interest today with CDC and others publishing that up to 23,000 people may die each year because of antibiotic-resistant infections. And so that discussion has spilled over into agriculture because we use antibiotics, particularly in pig farming, but in all livestock species, to treat bacterial infections and to improve the health of the animals that are in our care. And so as a veterinarian, I'm concerned about antibiotic resistance both in treating my patients, pigs in this case, but also obviously as a member of society, I'm concerned about antibiotic resistance when it comes to being able to treat infections of human beings. And so we have taken on this topic because of the interest that society has, because we're concerned about those things and wanting to make sure that what we're doing as veterinary practitioners is not harming our ability to treat human beings with resistant infections. We realized that we had our own data set on antibiotic susceptibility and resistance through the case submissions that our veterinary team had been making over the last 15 to 20 years. We have data for the last 18 years at 3 of the major veterinary diagnostic laboratories that we work with, and we have about 4,500 cases of infections or caused by one of 5 major swine bacterial pathogens: Strep suis, Haemophilus parasuis, Actinobacillus suis, E. coli, and Salmonella. And so we decided to look at those cases and look at the relative level of susceptibility or resistance for each of those cases and track that over time. And we simply assigned a value of 0 for a susceptible bacteria to a particular antibiotic and a value of 1 for one that's resistant to create an index. And so that index ranges from 0 to 1. As you might imagine, we track that over a period of about 17 years, and what we're finding is a pretty flat line. So that's good news, and it matches really what our clinical observations have been in general. We're not typically finding an increase in cases of resistant swine pathogens of the 5 that I mentioned. And so, clinical observation seems to match the data, at least in the way we've analyzed it to date.
So it sounds like this is consistent with the pork industry's pretty good track record of using antibiotics responsibly.
I think that the pork industry in general, pig farmers in general, have been very proactive in making sure that we're using the tools we have available in a responsible manner and making sure that we're providing a safe and wholesome product for the consumer. We're making a very intentional effort, particularly with the concern of society about antibiotics as a tool, to make sure that we're always emphasizing responsible antibiotic use. It's not that that hasn't been a priority, but it's something that we are emphasizing more and more today, making that sort of top of mind for sure. In that, we're also looking for non-antibiotic type tools to better promote the health of pigs. And so we're big proponents of preventative vaccination. We're big proponents of the right management techniques to more effectively raise pigs in a healthy environment. We're all about disease elimination. So there's a lot of things that we can do to better optimize pig health and performance that doesn't rely on antibiotics and that really promotes overall health in general. Typically when a veterinarian gets called to a pig farm, the first thing that they do is they employ their clinical skills to evaluate based on the age of the pig and the clinical signs and the number of animals that are displaying those signs, and then potentially a necropsy, what's actually happening. And based on those observations and putting all of that information together, a clinical diagnosis will be made. And we'll oftentimes have to, if it's deemed necessary, prescribe antibiotics. Samples then are collected at that same time and submitted to a diagnostic lab. And it usually takes a couple of days in order to get a culture and then a sensitivity result back to us. And by about that time, we're getting some impression on the effectiveness of the treatment that we've prescribed.